According to a 2017-2019 report by the Michigan Department of Health and Human Services, MDHHS, about 14.6% of children under 18 in Detroit have current asthma. That rate is significantly higher than the statewide average for Michigan children, 8.4% statewide during the same period.
The hardest part, the first time when I first found out she had it, she went like kind of cold turkey at school, and that's when I found out she had asthma. So the hardest part is her maintaining her medicines, and I hate that she can't play certain sports. She want to play soccer, but I'm kind of scared for her to do that. She want to do swimming. I really don't want her to do that either. So it's just like I want her to live a normal life, but asthma seems like sometimes it takes control of her body. So that's the hardest part for us. But we
So we would refer patients if they were having difficulty with asthma. We had a lot of patients who were being hospitalized or going to the emergency room and they needed better education. So we often refer for asthma education. A big part of our practice, a lot of pediatric patients are obese or overweight. So we would refer to a program called Fit Kids, and they would reach out to the families and have meetings. I became one of the mentors for Fit Kids, and we would meet weekly and walk with the children and mostly kids, and we would do walks. And then as they got better, we would prepare for a 5K down at DeQuinder Cut in Detroit. So that was fun. And patients would often ask, parents would ask, well, can my other kids come too? Even if they weren't involved in the program, they would work with families. So I really liked that program.
So that bridge is real important. You know, physicians have their own language sometimes, and they forget that nobody knows what we're talking about. You can't use medical terms with most people because a lot of those medical terms are very difficult in trying to translate that into something that a lay person to understand.
Right.
But then you have somebody like, you know, Kids Health Connection coming in behind you, and it's like, oh, that's what they were talking about. Then starting to get them to say, okay, when you don't understand something, you got to tell the doctor.
Right.
Don't sit there and be afraid. So that way, you know, so it just helps everything. And then you find out a lot of these people stay in the same neighborhood. Mm-hmm. And what happens is they may not even be part of Health Connection, but they have the same problems that their friends have. And they start talking to each other, and then they help each other. So, I mean, this is a big deal.
Yeah, it can really impact the community overall. Just having someone like a community health worker come in that can discuss with you, bridge the gap with the patient, and the patient can take it back to the community. So
exactly.
Really.
I'm Carol Johnson. I'm one of the first of community health workers that started with, at the time, Wayne Children's Healthcare Access Program, Wayne CHAP. And the impact that we've had is that we've had families that are still following us, even in other areas of their lives. They've found us and come and find us for other resources that we can provide them with, and having stable family life and situations. And they have also referred other families to us through other clinics and other resources and school programs that they feel that we were trusted to give the good information and resources that they needed. So we hope that families will continue to provide, or we can provide these resources for Kids Health Connection to continue our work, which is unique in the city of Detroit and Wayne, Oakland, Macomb County.
You mentioned that you had to take your son to the hospital twice. Have you had to take your son back since you've been introduced to these things to help you with asthma?
No, actually it happens. Mm-hmm. And they actually helped so much that my son actually goes to school. He goes outside, runs around like nothing. and it's really improved his ability to breathe even easier, and actually helped us clean our air inside our house and everything else. One one simple thing is it helped all the way around, even helped me and my wife personally as well.
So I think donations would really help impact children's health through education, Fit Kids programs like that. Being able to give the families something to look forward to. And a lot of times parents weren't aware that there was something to help their child. And so knowing that the funding was available to continue the programs, I think would be very impactful.